Hello everyone, welcome to the presentation. My name is Ruth Abbo and I'll be talking on future directions in health, informatics and methodologies for future direction predictions. Personalized medicine. There are two main medical concepts designed to bring healthcare to higher level: personalized and precision medicine. Their importance is difficult to overestimate because they are means to combat common side effects caused by general healthcare. Personalized medicine means that the treatment and intervention are based on patient specific needs and characteristics to avoid adverse effect. In this case, the treatment is as individual as possible. Precision medicine is based on the data obtained through such technologies as detailed data about patients' genetics and proteins and information about how these lifestyle and environmental factors influence patient satisfaction. Although both aspire to optimize the level of patient care, precision medicine can be described more in terms of product development and decision making. Data collection protocol. Data collection protocols are essential when creating treatment plan tailored to each specific patient. Indeed, a protocol is necessary for determining the process of obtaining patient data, including medical history, genetic data, and diagnostic reports. Several important concepts must be addressed when creating protocol. First, informed consent is required. Ideally, providers must explain why they are collecting this data and obtain voluntary and informed consent from the patient. Secondly, Secondly, standardized forms are essential for collecting data on different level of care. This allows us to compare resulting information to avoid inconsistency. Data security and privacy. Data security protocols can enable one to protect confidential patient information and make sure it cannot be shared with unauthorized third parties, which is regulated by HIPAA. Interoperability ensures capability with EMR, which is electronic medical records, and other system of data collection and processing. Data validation is used to verify data and ensure it does not conflict with what is already known about a patient. Patient engagement implies that a patient is pushed by a client to be more effective in the process and gains assurance that the data collected from them will be used effectively. Lastly, ethical consideration needs to be not just present but relevant, ensuring privacy and following ethical principles upheld by the professional. Patient selection for implement Patient selection for the pilot implementation. Various steps make it possible to select a limited number of patients for the new medication pilot. The first one was to identify criteria for qualification, which include type, chances of recovery or improvement, and the individual's level of engagement. For example, it may be individuals suffering from chronic limb or those who have survived incapacitation for a long time. The second step was to find the second step was to find the patients and after that get their written signed consent. In this step, patients have to be informed about the threats and available opportunities and express willingness to participate in the trial. It is important to keep track of the result at every step and adjust the course of action to maximize benefit for all subsequent patients. Treatment plan development. Personalized medicine involves several important stages in the development of personalized medicine involves several important stages in the development of individual plans for patient treatment. First of all, these are data these are data analysis. It includes studying the data of the patient, namely the medical history, genetic characteristics, and diagnostic result. It is important that a specialist does this in order to learn more about the previous treatment method and outcome. In this approach, AI insight is of particular importance. An equally important process is collaborative planning, where experts in the field of medicine, genetics, and AI work together to develop individual plans that take into account the patient's specific situation and response. As a result, a personalized plan is created that takes into account genetic predisposition. Next is the implementation of the development plan and on-time monitoring and adjustment. It is necessary because in this case, a medical professional can track how the patient responds to therapy and change the plan if necessary. Physician and staff training. The staff could consequently be trained on the following: precision medicine overview to educate the staff on principles, goals, and benefits to patient and the clinic. New protocols and workflows, which includes collection and analysis of new data apart from patients' care protocols. Train on AI Train on AI tools and applications, which is the tools that the clinic uses to analyze data and support decision making. Precision education, and lastly, hands-on practice. Ongoing support should ongoing support should then be offered to support continuous learning and the possible resources for the staff. With a focus on precision education and hands-on experience, the training will provide users and physicians with the education ability and abilities necessary to properly introduce precision medicine into their practice. Patient monitoring. Patient progress monitoring. The team will also adjust their strategies and well based on real-time data and the feed provided by the patient. The group will continue to monitor the status of the patient through the critical signs, the lab results from the previous test, and the response of the patient to the therapy. The patient reported outcomes and experience will guide the adjustment, which will be further refined by AI analysis of the trends. The team will also call the patient regularly to check on the progress to enable proper adjustment. Additionally, the team will be making the appropriate decision during the team meeting. Outcome assessment. The outcome of the pilot implementation will be evaluated by comparing patient outcomes and the efficiency of treatment to historical data. The analysis will include tracking very key performance indicators that may include patient recovery rate, health metric changes, or adverse event in detail. How patients receiving personalized treatment will ultimately perform against such metrics when compared to patient samples who receive standard treatment informs the team on effectiveness. This will also request the Also request for the patient's feedback and determine the patient's quality of life post-treatment. Statistically, analysis will be conducted to determine if exists significant variation in outcomes that enable them to assess risks, ensuring the pilot's success for future use. Feedback inter Feedback gathering from patients and medical staff about the integrated approach of precision medicine with AI could fall on the line of direct health benefits. Easier and faster recovery times and health improvement for patients with personalized plans will be accessed by patients to use the system. Ease of access of medical records and personalized health information and treatment plans will promote patient-centered care. Patient will appreciate the ease of access and understanding and enhance care and communication. Integration. Feedback integration. Gathered from patients and medical staff about the integrated approach of precision medicine with AI could fall on the lines of direct health benefits, easier and faster recovery times, and health improvement for patients with personalized plans will be accessed by patients to use the system. Ease of access of medical record and personalized health information and treatment plans will promote patient-centered care. Patient will appreciate the ease of access and understanding and enhance care and communication. Patients will also their concerns about their data privacy due to the use of AI in critical decision making. Health professionals would witness position related to treatment of their patients and more targeted intervention and appreciate reduced workload, save time using AI system through data analysis. However, they will also need constant training and handling skills on the AI utility system. Feedback Feedback should input or analyze about the practicability of new system and integrated protocols in the old system or protocol to plan informations and implementing personalized care plans. Public awareness and education. First, the key means of education are seminars, workshops, or talk public talks aiming to inform community members on the advantages of in, indolence and medicine and AI. It is first and foremost necessary to define the target group such as community terms. So patients and healthcare workers who require educational intervention. Second, the topics of presentation are related to the change of medicine may introduce into their care, AI's role in making decisions during treatment and diagnostic, and the question of data protection. The third is to select the professionals to make this presentation to present it at different intervals and places to meet everyone's expectation. Fourth, promote such presentation through local social media, news, and centers to create an encouraging environment. Fourth, put together the presentation and handout on the mentioned question to secure the information transfer. And lastly, add rebuttal to identify policy and provide the public with an opportunity to ask questions of their own. This is what I have for us today. Thank you for listening, and um bye bye.